AI without PI is not going to work out. Artificial intelligence without practical intelligence is not going to work out. When you practically understand what you're doing, then you apply AI on it, you can improve it. But if you're starting off with nothing of practical, don't change your processes, but you digitize them.
Hey, I'm Guy Powell, and welcome to the next episode of the Backstory on Marketing and AI. If you haven't already done so, please visit prorelevant.com and sign up for all of these episodes and podcasts. As you know, I am the author of the upcoming book, The AI Marketing Machine, and you can find more information on this at marketingmachine.prorelevant.com. Actually, we're getting really close to being able to publish and make sure that you find out exactly when it's available. We'd love to have you download a copy and give us your feedback. Today I'm interviewing Sam Yaruva. Let me tell you a little bit about him. He is the founder and CEO of PyCube, which is a company transforming the way hospitals operate behind the scenes. With a background in electrical and computer engineering and training from Harvard Business School, his decade working inside hospitals has revealed many systematic problems. While clinical care is world class, operations are often unpredictable. Motivated by a personal experience where critical biopsy samples were lost for 10 days, Sam launched PyCube to bring true operational intelligence to healthcare. Today, PyCube helps hospitals track assets and supplies in real time, saving caregivers hours and unlocking millions in recovered efficiency. Sam, welcome. It's so good to have you.
Before we go any further, a quick pause. This is important. Your sales force is one of the most expensive investments in your company. The real question isn't who's likely to buy someday, it's who should be called right now to create the most value. Traditional propensity models tell you who might convert. Our prescriptive modeling, called COPA, tells you who will convert because you called them. If you manage a large sales organization and want higher conversion, bigger deals, and better use of every rep hour, let's talk. If you want your sales team focused on the calls that matter most, visit prescriptivemodeling.prorelevant.com and set up a short strategy session.
Guy, thank you very much and congratulations. And I look forward to the new book coming up. And pleasure is mine. Thanks for having me.
Oh, absolutely. When I saw your resume and your background, I said I definitely want to understand what's going on with AI and healthcare. So give us your backstory. Tell us a little bit about what's going on with you.
Well, I'm an entrepreneur. I'm a serial entrepreneur. I constantly look for newer things and what's changing and where can we actually make an impact as we are moving forward. We are right now working in healthcare. We feel that healthcare when you go to a hospital looks like a five-star, seven-star hotel, which actually takes care of the patients. There's no question. It feels like you're going into the Star Wars kind of a scenario. But when you peel off the onion, there are a lot of things. It's almost like a cruise ship moving every day with so many moving parts and everything, taking care of patients. Many skilled labor are moving around. So we noticed that there's still pain in efficient operations within hospitals because it's a service industry. Everyone does things differently, so they seldom don't find vendors in every area where they want to have vendors or people who are providing services in that area. And the technology is not adopted, and everyone knows that hospitals are a little laggard in some way, shape, or form because they're in a in a compliance world like finance and stuff. So that hinders them to actually adopt technology as soon as possible. How do we make this difference? How do we make them apply technology in the right places so that it actually saves the time from the pressurized and stressed out personnel that they have from COVID? They've been stressed out. How do we bring down that cost? How do we bring down the cost that they have on the downstream on the vendor side and make it more efficient so that they can put the money back in where they're supposed to be on the patient care side. So that's the game, and we're looking at not just improving technology. We're not inventors, we're innovators, and we We believe that technology doesn't sell, solutions sell. What is that you need? How do you sell it? And how do you adopt it? And how do you make it very cost effective for health systems to embrace new technologies and get into this new world of AI? And how do you make this path paved so that it makes it easy for them to go and so that we're all living in a better healthcare for tomorrow?
Yeah, that makes a lot of sense. You know, it amazes me, when you go to even the doctor's office, how some things are incredibly well done. You know, when they think
Yeah.
when they're trying to, first of all, make sure that you are you, that they're talking to the right person and it matches whatever. And then second of all the barcodes on everything, and all these different things to make sure that that belongs to you and whatever, and which is very impressive. And because I can imagine if if a blood sample got mixed with somebody else's, that would be one of the worst things that could ever happen.
Yes.
I want a second opinion on that one, that's for sure.
Yes.
Yeah, exactly. What that means though is there's really, at least in that area, and certainly it sounds like in other areas maybe not so much. But what that to me means that it really indicates this operational intelligence of what's going on. Well, why don't you do me a favor? First of all, tell us what is operational intelligence, and then how do you see it changing the way hospitals and healthcare works on a day-to-day basis?
Well, yes, I think you eloquently started off with that, right? You go to a hospital today, then you have a barcode on everything, and barcode did change our lives because previously they used to write with a pen and paper on top of it. So, and I could write it, and we all know how a handwriting of a, a person is when you're actually still you're writing too many of them. It might look like a Sam or a Same, or it could be anyone else, and you don't want to mistake them, right? So barcode did help by standardizing and digitizing. There are improvements that you can make in different things. No technology is perfect. When you're doing these kind of things, it's called a chain of custody. When you're collecting a sample from someone or when you're actually moving from a patient to something. So there are many people who are involved in getting that care to a patient guy. So what happens is in even pharma, right? If you need a medicine, then you're supposed to make an order to the pharmacy, and the pharmacy is supposed to give it to a courier. The courier goes and gives it to the nurse. Nurse then gives it to the charge nurse, and there is a chain of custody that happens. And if you don't have, and if something goes wrong, how do you go back and look at things, right? So that's what stresses them out. And if there's an incident that happens, how do you go back and check what happened? That's typically what happens, and because these are the problems that you learn from, and if you have those digital footprints of different things that happen, it's easier for you to go. So healthcare has gone leaps and bounds beyond a couple of decades. I mean, I'm even talking about in 2000s. We have come a long way from there, but there are definitely pockets that are still not working out. And it's a compliance industry. So what happens in compliance, I'll just flip it. Whenever there is a industry like healthcare or finance, when you have compliance, you tend to do a compartmentalization. It's like a bomb thing, right? You call it a bomb blast. When you have a bomb or a fire in one room, you want to keep everything closed off so that the next room doesn't get it. So in security also, that's what they do. They compartmentalize things. When you compartmentalize things, the airflow doesn't happen. In this case, the data flow doesn't happen. The data keeps in silos in one department to another. Cardiology doesn't necessarily talk in the same way they were supposed to talk to the nephrology, not in the patient side, but there are a lot of things happening on the back end. So, how do you connect these dots? How do you make it less siloed environment in the health system? When you bring down these barriers of how the data flows between these things, you bring in efficiency, you bring in intelligence. Once the data is clear and standardized, the workflows that they're creating, if they're digitized, then you can apply AI on top of it. You're optimizing this to the next level. So the intelligence comes from, first of all, data, right? Everyone is smart till they see the data, I say. If you don't see the data, you're like, I don't know what's going on. Once you see the data, everyone knows it. So that's the pace where we're actually playing. How do we make sure that the blind spots that we have in care, in day-to-day operations, can be digitized and visualized properly? And once you see the data, I knew that that was happening for a long time. Now, how do we make it better? So you can't um, make anything better that is not measured. So you start measuring it, digitize it, then you start improving it so that the efficiency starts coming in. That's how we put the intelligence on top of it.
Yeah, that makes total sense, and you're so right. I mean, in our business as well, we do marketing analytics and consulting, and data is everything, and getting the data, not just getting the data, but getting the data right and vetted and making sure that it absolutely is correct is a big piece of the effort. Now, AI has come on like just like a sandstorm, and it is everywhere, and it is just
Yeah.
blowing across and just doing some really great stuff. So, how do you see AI being applied in hospitals? And I guess, certainly it has to be used in a practical way, a safe way, and a measurable way. How do you see that taking place?
It is a very important question that people have been asking me. I recently talked to a CFO for a big health system, and he was like, Sam, tell me, how do I use AI? And I said, should I change all my workflows? Someone was advising me that you would have to change your workflows to make it different so that you can actually apply AI. I said, no, 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 you should not be doing that. I said, why? I say AI without PI is not going to work out. Artificial intelligence without practical intelligence is not going to work out. When you practically understand what you're doing, then you apply AI on it, you can improve it. But if you're starting off with nothing of practical, don't change your processes, but you digitize them, right? So once you digitize, that means, and what happens is many of the times, many pieces are not very digitized. Example, I'll give you an example of Uber Eats. Previously, when Uber Eats came in, my only way of getting my food was going to a restaurant and ordering it there to go and getting it there. When Uber Eats came in, initially I could order it, but I was still initial phases of it. I did not know when it's going to come, what's going to happen. Did the courier or a Uber Eats driver actually take my food? I don't see it in my door. Did he leave it at my next door, or did he eat it, or I get it? So there was a lot of uncertainty. Now you can actually see Uber Eats. Where is the car? What is happening? When did he pick up? What's going on? So that is the digital workflow, is what I'm arguing. The workflow that you're doing, if it's not digitized and people are not transparently looking at the data, it's a he or she shares. Yeah, maybe about 5 years back, I would have, called in the restaurant owner and said, "What the hell happened? I just ordered my food and it's not here." Now it's no longer the case. I know when he picked up, what is happening and what not. So when you know this process flow, then you can improve it. Then you can say, "Hey, why is it taking me 20 minutes for the food? Can I make it in 15 minutes?" So industries move forward by improving efficiencies around it, right? Then AI gives you an opportunity to automate, but how do you improve it? There are many things that a human mind cannot do it. AI is nothing but it's automating, improving um, the day-to-day things that we are doing. It can be applied in multiple ways that the human brain cannot think. It can think multiple angles in one way, one stop. I still remember my days when I was working on the old kind of an AI. Was there for a long period of time. What happened here is the language model. That is a new thing that came in. They say a human being takes about 5 to 6 years, 3, 4 years before they start talking. It's the longest a species, a new species, when a newborn is born. It takes such a long time. The complex part why humans take such a long time is because of the language part of it. That is the most complex part of this. And that is what this new AI has brought in. It understands language. And that is what made it easy for everyone to communicate with it. Now all the brains are working on it. Now it's learning from all of us. It'll be a fast transformation, and we it has a lot more knowledge than you and I combined. And that is you can ask it any question, it gives it. It's not perfect, but it's getting better. It's a lot better. And now you're able to apply it and ask questions in a normal way that you and I are talking, and it might be able to actually give you some answers and solutions. And one idea and perspective that it gives might change the way you're thinking, and that was limited previously for us. And that is exciting for me on that front.
Quick pause. This is important for any marketing leader. Marketing must continuously prove its value or the budgets dry up. Marketing mix models provide that proof in a way finance and leadership can believe. And we at ProRelevant help teams answer critical questions. Which campaigns actually worked? which channels really moved the needle, and where should the next dollar go. With over 20 years of experience across complex marketing environments, we know how to deliver clarity, not guesswork. To learn more, go to mmm.prorelevant.com and set up a short strategy session. And now, back to the podcast.
Yeah, absolutely. And it is amazing. You can put in your thoughts and they can be even maybe not totally correctly the way your thoughts, how
Yep.
you want them organized, but it'll figure that out and it'll give you an answer. And the answer, though, is also a little bit misleading because it is so well written. And you see it
Yeah.
and you go, yeah, this makes a lot of sense. And yet sometimes when you peel the onion back, you go, well, wait a minute now, it really does make sense, but it's not really the sense that I wanted. And so there does need to be a little bit of certainly human intervention there. And now, of course, some of the AI that has improved operations, has directly impacted patient care and maybe even improved the burnout of nurses and medical staff. Can you give us a real example on that?
Yes, definitely. So, since COVID, obviously there is a lot of churn in people because, I always say that not just COVID, America here and a lot of places, we are living longer. There is no question around it. Healthcare has come a long way, and every year, year over year, the more and more tests are coming in. About a decade back, we probably did not have any tests for certain things like Alzheimer's, and suddenly you have a test for Alzheimer's now. Now you're detecting diseases through biomarkers research. AI is applied in that area. Now the research actually gives you therapeutics or some kind of medicines and stuff to treat it. Now you're able to diagnose the disease. More tests are coming in. More people are living for a long period of time. They're doing more tests and they're actually trying to stay for a longer period of time. That adds, but number of hospitals, if you go back and look, I don't think that has changed dramatically. But we are living longer, and there are more tests coming in. I'm going to the doctor for more things because I want to get
Hmm.
tests for everything I feel. As a human being, I want to take care of it. So it's the same population but aging. We are living longer, but the same set of healthcare personnel and the way they're treating and everything of that sort. It definitely puts stress because it's a bottleneck, right? Hospitals become the bottleneck, clinicians and everything becomes a bottleneck. And now what happens, and there is another stress that you have is when you're these days when the kids getting educated, not a lot of people are getting into a more clinical setting for teach yourself for 10 years. Oh, maybe I can go to social media and start doing YouTube videos and probably get money. So a lot of youngsters are actually not getting into a lot. They don't have that uh, try to focus and take it for a long period of time, sustainable way of growth and everything of that sort. So that adds pressure into the community, that adds pressure into the health system. There are different pressures from new nurses and trained personnel providers coming into the system, new hospitals, new communities coming up, and you need to actually serve them as well. People are living longer, new tests are coming in. That gives you, there is no way of sustaining that by adding more hospitals. A, you either change the way you take care of patients by remote way of looking at them. B, you can actually have home care, which is being prevalent. And the second thing is you have adopt technology, keep adding technology to it. Nurses that are doing things, and now the ratio of number of cases per nurse has gone up. Previously, they were taking care of less number of patients. Now the same nurse is supposed to take, 20 more people. How do you cut it down? You have to adopt technology. You have to cut it down the process. You have to bring down the brave people who are working in the hospitals when you have between the diseases and stuff. You have to bring down the stress level, make it easy for them to actually chip down 5 minutes from here, 5 minutes from there, 10 minutes from here. It makes them feel, wake up in the morning and go to the hospital. They're not stressed out as much. Give them some breathing room so they can eat. I will give you an example of a hospital that we demoed our solution. I didn't expect this, but once they showed our solution and piloted it for about a month or so, the feedback, I didn't expect this. The guy came back and said, now I know I get this 30 minutes to eat some lunch. I'm like, what? So that was it was not saving lives. Yes, it is absolutely you're saving lives, but the basic thing is basic things, sometimes smaller things. I have time to eat my lunch. I have time to breathe.
Mm.
That was a big thing for us. And that's what you give the time back so that they can actually do it. You have better productivity when you have these kind of things done. And then you have, better outcomes because people are, looking at you from a different perspective and they're in a better mood and better ways of looking at it. So those are the areas where you're actually working out to make it less stressful for the health systems to work on.
Yeah, yeah. So, sometimes when you think about hospitals, at least, some of them and maybe all of them, they are from the clinical results and the actual, results that you get, they're world class. But on the other hand, behind the scenes, they might be held together
Yeah.
with duct tape. You kind of came up with that. So tell us about how where you came, what was the genesis of that, and how real is this as a problem?
Yeah, that came back from the thing I was telling you when I was young and younger, I should say. When I was working on it, I felt like these hospitals have so many different, it looks like a seven-star hotel, but when you go back and peel off the onion, I felt like the systems were not, they didn't know any information. They had a lot of people are, depending on the second person who's actually working. Oh, Paul knows about all these things. Paul, do you know the best or are you following the best practices? Yes, he says yes, but actually not. So the Paul is actually making decisions to make sure these things are happening. I felt the facade that you see, like a car that you put together, but the engine is ducted, not with the. I
Mm.
had a feeling that, what if something breaks? So I was working previously in one of the hospitals. I don't want to mention the name, but I was a data center architect in my previous life, and I used to design applications that could actually fail over from New York to LA within milliseconds. With that job, I had an opportunity to work in one of the hospitals, and I had to go to the data center that they had locally, and that was on the top floor of that hospital. It was right next to the helipad of that hospital. I'm like, so you have this connected to people's ventilators and stuff, and God forbid the helicopter comes and crashes, what happens to the patients and the monitors, everything connected here? Maybe not the best idea, right? They say that you don't want to eat in a restaurant where you work. You don't know what I was like. Oh, this is not the right place to actually come in. So I through my experiences previously, there are a lot of things happen on the front end. They do fantastic world class treatment and they take care of patients. Not that everything is needed from a technology perspective to take care of the patient, but they assist. But the way they actually do it, because their bread and butter is to take care of patients, not take care of technology, not do a lot of different things
Mm.
that they have to do to make this happen. But they lack tools, they lack the right mechanism. So that's where I came up with the analogy saying, on the front they look like a brand new Ferrari, but if you lift the hood, it looks like it's all connected with the duct tape, not even with the screw and stuff. So we need to help them out, give them the right tools to make sure this works out. So that's how we started the journey around the healthcare side of it.
Yeah, fantastic. Well, and I hate to say it, that's probably the case with a lot of different industries, although in healthcare, the risk or their impact is so much higher. It's lives and health and what have you. One of the challenges, though, if you're going to do some AI-driven operational improvements, is how do you determine the ROI and how are leaders thinking about that? And are they measuring? How do they determine that, hey, I did this improvement. Where is where's my return on investment?
Well, yes. That's a question when you reach out to the decision makers, when you start looking at how do you see the ROI for this AI. So one mistake I think I would say I break it down into two pieces, right? AI, first thing I told you, AI without PI is not going to work out. You don't know where to apply it. Don't apply it. There are places where you can apply it, right? You need to have a problem area where you're giving a better ROI. That means the benefit has to be higher, definitely. So I normally argue that apply AI where you're between the departments at enterprise level. Between the departments, you have the most gap. the tools have gaps. Those are the areas where you can actually put this thing. But when you're applying technology, what I've noticed is it doesn't have the same thing that we had previously as a platform play. I'll have a platform, you start using AI wherever you want to. That is not going to work out because it has to be very pointed. AI has to be applied very pointedly. I don't think it has grown up to a level where it can be a platform play. Second thing is AI cannot be brought or sold or from a vendor. AI vendor has to be a partner. So you have to work with them. You have to understand their workflows. So when you're applying from a business model perspective, when you want to sell or play in AI, you have to be a partner for your customers and hold their hand, work with them, understand the workflow, and be a pointed solution. What is that you want, and what is that outcome that you need? Then you apply AI. You have to understand the outcome, or else the AI it's smart enough that you could get different outcomes than what you think. There is also another piece of the puzzle is governance. The governance piece is very interesting because AI is so powerful that if I ask a question saying, "How is Guy doing today?" I might get a different answer and you might get a different answer. It is smart enough to give. It's not 2 + 2 is 4.
Hmm.
So there was one of the friends of mine when I was talking to him. It seems when they were testing the AI. They made it a very specific AI bot, I should say, bot that was actually being used. It was good, it was working, but when they started testing it properly, that same AI bot, which was actually giving some customer information, reaching out to the customers and asking them about their feedback and surveys and stuff, when tweaked and asked questions in a different way, the same AI gave you the information about how to make a bomb. And you don't want your AI. It's a human bomb, the bomb that can actually blast. It gave a recipe of bomb. So you don't want to build something and has a unnecessary outcome of it. So you need to have governance place properly. If you're able to take those things properly with a proper outcome, which actually lasts for a long period of time, then the ROI. So you have to have a deep impact on this, and that ROI has to be. So if you're pointed, you're able to measure it. If you're distributed, you can't measure the AI mechanism, but definitely have a governance that actually works in. If you build these blocks, then you start applying at appointed areas. I think you can actually achieve ROI at at a business leaders level where they can understand the right outcome of this. I hope I made
Yeah.
sense.
Yeah, no, absolutely. And I think that's where, the kind of the rubber meets the road, because on the one hand, the hospitals can't just lose money. They have to be, most of them are nonprofit, but that doesn't mean that they are not for profit. They have to have some
Yeah.
kind of a cash flow, and you do have to pay, pay a
Yeah.
competitive wage and stuff like that. So, and it's critical to make sure that whatever you're doing has a positive economic outcome. Um, so what advice would you give a someone that's wanting to now enter healthcare and the healthcare field, and then with all of this AI infiltrating every area in the business? What do you see? What advice would you give them?
Uh, there are many things. If I, depending on who I'm giving the advice, if it's an entrepreneur who is actually coming in, or a executive from the healthcare, or from a new kid who is just graduated, first of all, don't think AI can solve every problem. Respect the problem is what I would say, because there is a feeling in the market that, hey, you just apply AI and start working. Can we do that? No, I don't think it works that way. That is the first thing I'll give, because be careful about applying AI on everything. It's not might not be the best. It's a tool. It's a technology. It's a tool that you're actually applying in different places. Second piece of the puzzle, if they're getting into healthcare, I would say don't make an AI that is conclusive. Conclusive in sense, have a man in the middle, have a person, a guy or a
Hmm.
gal in the middle who's actually knows what is happening. You can cut down a lot of steps from it, but don't make it fully automated, because you might have false positives unnecessarily, and that would be an advice when you're positioning yourself on the AI side. But AI is changing very fast. Keep up with AI. Every 3 months, you're getting new updates around it. Um, don't hesitate to go from patient care side, patient experience side of it, because there is, when you get into healthcare, what happens, the biggest problem that you face is, oh, it's compliance. Maybe I should not touch compliance. I should not touch patient at all. I say that if you look at the healthcare system, the AI is applied today. The only place that I feel it is crowded and has a lot of AI being deployed is in the patient experience and revenue cycle, the front end part of the hospital, where how are you taking care of patients? How are you collecting the money to keep my lights on? Those are the two areas which are highly compliant, and that is the two areas where the AI is being applied. So don't hesitate to go places where the money is or where the patient is, where the heat is on, because that is the most pain that you have, and that's
Mm.
where they're applying it. So there are many other areas where you can play. We play in operational efficiency because that is needed as well. But you will have an option to go in different areas. Don't be shy to apply in the right places, but don't be too prudent or don't jump the gun by applying it in the wrong place. Be respect the problem and start seeing, understand the problem, and then get in and apply AI.
Yeah, it makes a lot of sense, and I think there is a a desire to use AI everywhere and where it doesn't really belong. So that makes a lot of sense. Well, we're gonna have to cut it here. Sam, it's been very interesting, and healthcare is just so critical, and one of those new areas where AI and what these large language models can do is really infiltrating everywhere, and certainly to understand what can happen in the healthcare space. So, where can folks learn more about you and your company?
Yeah, we have. I am active on LinkedIn. You can find me on LinkedIn if anyone is interested. We have a lot of information about what we're doing on our website as well. It's www.pycube.com. My email is sam@pycube.com if you need any, want to have any conversations. If the executives or anyone in the market has any questions, more than happy to interact with any of your audience who's willing to have a chat with me.
Fantastic, absolutely. Well, so Sam, thank you so much, and for the audience, definitely stay tuned for many other series in the backstory on marketing and AI. And if you get a chance, please go to marketingmachine.prorelevant.com and find out more about my upcoming book, The AI Marketing Machine. Sam, again, thank you so much.
Thank you, Guy. Thanks. It was a pleasure being here.
Absolutely, mine too.